Greetings. My name is Dr. Waddell Brooks, Sr., your host, and this is Community Forum. We have an outstanding program this evening. We're going to be talking about moral injury among combat veterans. And we have 4 exemplary guests. The first, to my extreme left, is Dr. John P. Patrick Baer. He's a clinical psychologist at the Captain James A. Lovell Federal Health Care Center. To his left,
right,
to his right, we're right, is Sergeant Charles Robertson, Vietnam War combat veteran, U.S. Army. And to his left is Miss Cassandra Shimza. She's a doctoral student at the Adler Institute with a specialty in military psychology. And the anchor guest is Sergeant James Robertson. He's a United States Marine Corps.
Reinhardt.
I'm sorry, Sergeant James Reinhardt, make that change. United States Marine Corps and Vietnam combat veteran. And of course, our illustrious co-host is Mrs. Tara Thomas, an educator in Lake County. Greetings, folks.
Thank you.
Greetings.
Tara, we have an outstanding program today. We're going to be talking about moral injury among combat veterans. And we have an outstanding person, Dr. John P. Patrick Baer, has been on a program several times. He's a clinical psychologist at the Captain James A. Lovell Federal Health Care Center. And we may want to start with him in our discussion about moral injury.
Okay, I think it's a very serious topic. It needs to be addressed because it's also really flowing over into other professions, like the football players, for example, are having similar problems.
Okay.
So I think it's a very serious issue, and it's impacting the society in various ways now. So, Dr. Baer, correct?
Yes.
Okay. Give us a little bit about your background. I was wondering if you're originally from Illinois and why you elected to go into this type of specialty.
Well, I'm proudly from Wisconsin,
Okay.
but I did my academic training at Northwestern University, and I worked at Evanston Hospital for 16 years. In a network, I became familiar with post-traumatic stress disorder, traumatic brain injury, and moral injury. And I worked with firemen, I worked with police, I worked with school shootings, but it was not until I worked the last 22 years at the Captain James A. Lovell Federal Health Center where I really learned how deeply serious and how tragic moral injury is. And so I want to say to you, Tara, as hostess, and Dr. Brooks, we're so pleased from the Captain James A. Lovell Center to be here. And we want to say to your viewing audience, we considered a great opportunity to speak with people of Lake County and to invite them to consider this topic. They know veterans and they know civilians who have moral injury. And we ask that if you have any knowledge of any veterans in Lake County and they have issues from war that have to do with PTSD, that have to do with moral injury at war, that we invite you to refer to us at the Captain James A. Lovell Center. This is a vital topic. It's a tragic topic. There's too much human suffering. There are people tonight who are depressed, people tonight who are having abuse in the family. There are people tonight who are drinking or drugging and they're in a state of mind where they may be suicidal. And we want to reach out to anybody and any veteran.
Well, that's what I was going to ask you. How would a person know? Does the individual, the veteran, or even, you mentioned earlier, firemen, policemen, yes. Does that individual know they're going through this? And if you could just, a lot of us are familiar with PTSD.
Yes.
Moral injury, not so much. So if we could address, how would they know? Or is it the spouse or family member or friends who can detect that disturbance?
Usually it's external.
Okay.
People don't talk about shame. They don't talk about moral injury. We call PTSD unspeakable pain, and moral injury is even worse.
So what would you consider moral injury?
Let's ask Cassandra if she would speak to this topic.
Okay, certainly. We also have this Venn diagram that really shows how PTSD and moral injury overlap. The symptoms.
And before you do that, I think we're going to bring it up on screen as well, so that the audience can follow you as you direct us on your poster.
Yes, they really tend to overlap. PTSD, as we're familiar with, very frequently found in combat veterans. You see a startle reflex. It's this kind of hypervigilance related to fear. There can be memory loss, flashbacks, intrusive thoughts coming as dreams, or flashbacks, similar kind of triggers in the environment can remind someone of an experience in combat, or really any other trauma. Could be in the civilian world, the same thing. They are often angry and depressed and anxious, insomnia and nightmares. All this occurs in moral injury as well. Many veterans will self-medicate with alcohol or drugs or both to kind of numb themselves from the pain. This unspeakable pain is too much to handle sometimes.
So is this a psychological pain, or is this an actual physical pain?
Can be both, actually. It's a good point. Really, psychological pain and deep emotional pain, but that can manifest physically through headaches, chronic pain in the back. People, you know, that feeling you get in your gut when you're upset. So a lot of physical pain can really be traced to this as well.
Okay.
With moral injury, the cause tends to be a little different. It's more related to a violation of what's right. So we see, whereas PTSD is more of a fear response, moral injury is more related to grief, to guilt and shame.
Okay. Okay, so that would be, for example, if a sergeant, especially if we go back to Vietnam, there's a lot of films out about the injustices that a lot of the soldiers endured during that war. And some of the things they either witnessed or were part of or part of, and they feel guilty. So that would be more of a moral injury?
Right. It could be self-perpetrating or witnessing the perpetration or feeling unable to stop it. So you hear about those war atrocities, some of that definitely leading to moral injury, or also feeling that they were wronged by, you know, a commanding officer giving an inappropriate order. So it could be the witnessing of it, the experiencing of it, or themselves being a perpetrator.
Now, Vietnam was in 1970. Well, I think it started in the 50s or 60s, but it ended around 1973, if I'm not mistaken. And so are there still men or women still suffering from this, like 40 years later?
Yes.
Is there, how do you treat it? How is it treatable?
If we could just go back to the fact that this has been around forever. Post-traumatic stress disorder and moral injury are through all wars. We're fortunate to have these sergeants here tonight from Vietnam, but we could have vets from any war that would tell you that there have been examples of things that are just hurt them morally, where they've done things that they didn't think they would do. In the case of shooting a civilian or shooting a child or a woman, these things happen in war.
But how do you treat them? How can they be treated?
Well, that's a big question. So at Lovell, we have residential treatment programs where people live in for 6 weeks, and we have one of the biggest outpatient programs of all the VAs, so that we have vets come in for once-a-week therapy, or with their wives or their families they come in, and sometimes they come in twice a week. Sometimes they come in once a month. But they come in, and we are specialists at Lovell. How do we treat this kind of thing? People need to come in and they need to talk.
So, Dr. Bear, are you saying not only are you treating the patient, the veteran, but you're treating the families as well?
We do our best to include family and significant others.
I'd like to find out from Sergeant Charles Robinson, how did you determine that there was a need for post-traumatic stress disorder? How did you know you needed treatment for it?
Well, basically, I was sent to the VA because the gentleman down at the Veterans Office said that the problems that I were having was all related to the military, to Vietnam. So I entered a program which was 6 weeks, I think it was 6 weeks,
Yeah.
on the stress unit there. Of course, I've been there about 4 or 5 times over the last 20 years. And incidentally, I've known Dr. Bear for 18 years. He's been treating me for moral injury and PTSD. So I got in the program, and I found out it wasn't bad as people said it was. So I started liking the program, and it helped me. I can't speak for other people, but the programs they've got going there, they really work.
Now, is there a cure for it?
No. This was 47 years ago.
Oh.
And I live like, I can recall 47 years ago on a split second. What happened to me in the war, the things I've seen, and the people that I've seen killed, my own people and the Vietnamese. So 47 years later, I still got it.
Well, Dr. Bear mentioned about treatment for 6 weeks.
The program.
The program is.
One part of the program is residential, but let me say that the place to start is to come in and have one session. You start with one session, you talk to one doc, then you come back, and then you come back, and after a while, we see what will work for you. So this is individualized treatment. It's not all, some people will go on the 6-week program, but many, many do not. Sergeant Reinhardt has not been on the 6-week program.
Never. You've never been on the 6-week?
Never have been.
Now, have you attended the center at Level? Have you gone there for treatment?
Yes. I attend Dr. Bear's group therapy meetings every Tuesday.
Okay, I notice you have a lot of medals. You know, I'm proud to be sitting next to it. I've never, actually, I don't know anyone with that many medals. So do you want to explain some of these to us and maybe what your experience was? Or can you discuss your experience in Vietnam?
I spent 2 tours in Vietnam. That equates to 24 months and 40 days.
Okay.
And the medals that I wear are, some are for doing heroic things, and some are, as we would call them, stupid medals.
Okay.
The Purple Hearts, as an example, typically were in the wrong place at the wrong time.
I see.
And I received 2 of those.
Okay.
The reason that I chose to take a second tour is because of my training. I'm with a special, I'm going to call it a special forces group, called Force Recon. And our training is similar to what most of the viewers would know as SEALs.
I was going to say the Navy SEALs would be similar to that?
Correct.
Okay.
Their training pretty much came from us.
Oh.
And because of my level of training, I thought that I would be doing my squad an injustice if I didn't stay.
I see.
I typically, I didn't take any R&Rs, that's rest and relaxation.
Right.
I would give them to people that I thought needed them more than I did.
Do you think that by not taking your R&R, it contributed to any type of reflexes you have now as a result of PTSD?
No, ma'am.
You don't think it had any bearing?
No bearing whatsoever. The problems that I'm suffering from now are basically from occurrences that happened over those 2 years.
I see.
Again, some of which I'm proud of, as some of the medals indicate, and some that I'm not.
I see. Well, I was just wondering, especially with the brain injuries, a lot of this sounds like it's psychological, but I know there's a frontal lobe when you're talking about memory. So do you, the loss of memory, is it more of what occurred during the war, or did you also lose memory of things you're doing daily, or things you did when you were younger?
For me, the loss of memory is not apparent.
Okay.
And I think that's one of the things that we wish on a day-to-day basis, is that someone would come up with a little white pill that would cause us to forget. That is our problem. we're faced with triggers that cause us to lock ourselves away, avoid things with our family, and just become recluse for the most part.
So the problem is not forgetting, the problem is you want to forget.
Yes.
Yes.
I see. See, that's totally different than was my understanding. So for you, Sergeant Robertson, you've been back 47 years. When you initially came back, are you from this area?
Yes.
Okay, so when you were in Vietnam, so when you initially came back, how do you feel you were treated, or what started for you, or did you just have reoccurring nightmares, if there's something you can discuss?
Well, actually, you're here one day, and you're back at the state sitting at the dining room table. When we came back from Nam, we didn't have any debriefings or anything.
Oh, really?
So you just got on a plane in Cameron Bay, you flew to Seattle, and you flew on home, and that was it. So 2 days before, you're sitting in the jungle eating, and the next day you're sitting at home with your parents, and everything is, you're nervous. For a whole year, you've been living in the jungle, so you're not accustomed to people having grace at the table and everybody sitting down and eating together. Normally you would eat with a guy sitting over there behind a tree and a guy over there with a rifle, so you could eat out of the canned goods that you did have. So it took a long time to get used to sitting down with someone having a meal. I don't eat out of paper plates today.
Really? Are there groups of veterans or your friends who you serve with, or even people you haven't served with, where you guys come together and just kind of mentor one another to help them adjust? Because if it's what you stated, how they just, at that time, it was just no debriefing, and you just got dropped here. Well, are there groups now to help veterans returning? Probably
so. You've got a lot of organizations that try to get veterans. A lot of veterans don't want to be around ordinary people.
Really?
Because they don't have any idea what we went through. We can't talk. I can't talk to Dr. Brooks like I talk to Dr. Bear. Because he's been doing this. He's been dealing with me for 18, almost 20 years. So for me to sit and tell other people, they look at you like you're dumbfounded. You don't know what you're talking about. It didn't happen. See, we see a lot of bad things in war. And if you're fortunate enough to live, I quote, it's not your time to die, then you're stuck with all these things. You got all these thoughts. You feel sorry, survivor's guilt. Your buddy got killed lying next to you and you didn't get a scratch. So
what we're going through, the country is going through now with terrorism and the war over in the Middle East. Can you watch that and not be affected?
Sometimes I watch it, but I know it's all a lie. War is war. You can't sugarcoat war. People are going to get killed, civilians, and they're killing a lot of Americans. So what are you going to do? You can't push it to the side and say this is not happening, because 47 years ago it happened to me. So if you're fortunate enough to live through these things and get home and hopefully you get some treatment, you're just lost.
Well, and that brings us back to the Level Center, which we're fortunate to have that in our community. Do you just treat people from this community or throughout the state of Illinois, Dr. Baird?
We have people from throughout the state. I mean, primarily we have this area, but we do have Wisconsin vets, Indiana vets, we have Michigan vets, and some come from as far away as Virginia or Florida. And that's important to know. That
do they have to be referred, or can they just come and check themselves in?
You have our number, and they can call, and we will greet them and meet them, and we will do outreach for them. And again, I just want to say how these kinds of disorders and problems are so severe that people have a very hard time asking for help. So it's often the family or another veteran. It's called unspeakable pain.
That's what I was wondering. Do they know they're going through this? When the relapses happen, Cassandra, I can call you Cassandra now until you become a doctor. Are the vets, or the person who's going through it, do they know they're going through it, or is there someone around them who is in their presence that witnesses it?
Both. I think sometimes they know something is wrong. They don't necessarily know why. They don't know why every time they hear a sound they flinch. Things like that. They just know they don't feel normal, or they don't feel how they did before they left, or they don't respond the way everybody else responds. But they don't always have that kind of insider awareness of what it is or what PTSD is. Think back Vietnam era, this diagnosis didn't exist as we know
Right.
it today. So for a long time, I think it was 1980 that the diagnosis, 83 really came out, and we kind of began to understand this really through our Vietnam era veterans, what was going on. So now with this current era, veterans are more aware of what it is, but still are kind of hesitant to come in. And when you talk specifically with moral injury and you add that shame, when there's this shame and guilt, you don't want to tell people you did something that you feel ashamed about.
Dr.
Nobody
Bear
does.
had mentioned before we went on the air that there are crimes are committed as a result of things that have happened in the past. Are they aware they're committing the crimes, or do they know they're committing crimes, or is it just is it symptomatic?
Well, I wouldn't focus on the crime. What I would focus on is that people who have been in combat and have PTSD and particularly moral injury may not be as in control. They might drink, they might be using drugs, they might be so full of rage and unhappiness that they can readily get in a fight. They can readily feel antagonism, road rage. They have a lot of unhappiness that can come out, and that can get a person in a position where they may end up with criminal behavior. And there's many vets who are sadly locked up. And should be in treatment centers.
Is there anything a family member can do if they see an episode about to occur?
We invite family members, we invite community members, we invite pastors, we invite counselors and social workers. If you know a vet who's drinking, can't sleep, who's anxious, who's having relationship problems, please encourage them to come to Lovell, to call us, to get a consultation.
Now, on the information you submitted to us, there are various criteria. Like you have criteria A, criteria B, something is...
Oh, that's for the diagnosis of PTSD.
That is for that.
Yeah.
Okay, so when they come in, so your patients are coming in with various of these, or all of them, maybe one or two, or how do you...
Well, for PTSD, the 4 areas have to do with re-experiencing nightmares and flashbacks. They have to do with...
Go ahead.
They have to do with emotional numbing. Just can't feel emotions, can't enjoy. They have to do with avoidance of stimuli for more, which you've talked about, and they have to do with thinking that gets cognitive perceptions that are just wrong, like survival guilt.
Okay.
That I'm to blame because my buddies died. I might as well die also. Life is not worth living because my friends were killed.
But it appears, just from this panel, Sergeant Reinhardt appears to be in control, or I don't know, he didn't have to go in for 6 weeks. Sergeant Robertson said he did go in for the 6-week treatment. So there's various types of treatment. And it depends on the type of injury you're personally enduring.
Well, it would be individualized treatment, individualized assessment and treatment. But I just want to highlight that both of these men are exceptional human beings.
And we appreciate them being here.
They've
today.
achieved so highly, but they have also had down years and down times. And had they not been in war, had they not had both PTSD and moral injury, their achievement would have been stellar. They would be school principals, and their business, Jim ran businesses, and it was only, he'll tell you, ask him about how
I'd like to know that, because you're saying you feel you have both PTSD and moral injury, correct?
Yeah.
Yes, ma'am.
You feel you have both. Okay, so how did that impact or change your life?
Both of them together, if I regress for a second, I worked for Abbott Lab for 31 years. At the same time, I ran 2 businesses at the same time. And once I realized, or I should say I didn't realize, I came to see Dr. Bear through my daughter. She wrote a letter and said, there's something wrong with my dad.
Did you feel there was something wrong at the time?
Well, I sensed it a little bit.
Okay.
And, but the mind being what it was, I did a very good job at covering it up. So the PTSD and the moral injury caused me to lose my job. and lose both businesses. So that was a large impact on my life.
I see.
With the help of Dr. Bear and the group, I've learned coping skills.
Okay.
Probably the biggest thing that I was doing was hurting my family. And with his help and the help of others, I don't do that so much anymore.
Okay. Do you feel that, so you've learned methods to, if you feel something coming on, how to refrain from doing those things?
Correct.
That's wonderful.
Sometimes I leave, or I have learned to put on a very good facade, I guess.
Like the rest of us. Like the rest of the world. Good for you. And Sergeant Robertson, for you, you said you've been with Dr. Bear for 18 years. 18 years, I beg your pardon. And through that, do you still go to regular meetings? Are there meetings like for other types of treatments?
I go to see him every Thursday.
You do? You
I can see him every day.
Okay.
You know, but
you go every Thursday?
Every Thursday for the last 18 years.
And do you feel a difference? Do you see
Yes.
improvement?
Yes.
Because he stated that there is no official cure.
No. But you can find a better place.
Yes.
You know, the things that I can go in a bar now and sit for 5 hours and never touch a drink. I used to go in at 4 o'clock and stay to 12.
I see.
So, you know, I don't partake in bars anymore because you can't sleep at night. So you figure you have a couple of drinks, you go home, you go to sleep. But then after a while, your body can't keep taking all of that. So with his help, he's helped me considerably with a lot of other things too, pertaining to the post-traumatic stress and survivor's guilt.
Well, Ms. Schisma, we're hearing a lot about family and so forth, but we haven't gotten the impact. We got it some from Sergeant Reinhardt about the impact, but we have a great number of families that are breaking up because of this. Do you have the prevalent to go in and talk with groups or organizations and about this type of treatment?
Do we go into groups and talk about it?
Groups and organizations.
If I may,
Okay.
Please.
we visit schools. We have a number of the vets and students who accompany us, and Sergeant Roberts and I have talked in schools for many years. We've gone out to schools and we've gone out to Rotary clubs. We reach out to, and from Lovell we have outreach workers who do programs in schools and communities to try to bring in vets and inform them of their benefits, some of which have to do with PTSD and moral injury treatment.
And what about I hear about the loss of family, but I wonder, what's the success of mending families? Is there statistics to show that you've mended some, or is it just, we just lost?
Well, I hope you'll invite some of our other staff in for a special program on dealing with partners and families. You know, Dr. Courtney and others who are working, and we could talk about that. But let me say this, the military tradition has been to treat the soldier, treat the Marine. It's only in recent years where we're really starting to catch up and bring in families and partners. So that's, and I'm very proud, and I think at Lovell we're quite proud that we have some programs for partners, families, kids, and we need to do more of it. Because you bet.
That's a real key, because
yes.
I talk with some veterans that the families just don't want them there anymore.
Right.
It's gotten out of hand, right? And
Yes.
I wondered about the programs to try to mend it.
Yes.
What type of inpatient services do you offer? Because I noticed in reading some of the things, it says Veterans Justice Outreach Program, inpatient services, mental health inpatient services, evidence-based psychotherapy. So these things, a patient would necessarily say that someone didn't want to stay 6 weeks on the premise.
Absolutely,
They
no.
could come in on a daily outpatient basis?
We want to stress that it starts with one session and coming to talk about it and learn about it, and then learn about what approach works for you. For many, it's shorter term, are some of our empirically supported therapies, 10 sessions. For others, they keep coming for years because the problems are so, PTSD, like any other disorder, it can be more simple or it can be more complex. And the more extensive the combat, the more time in difficult areas, the more severe the traumas, the more likelihood the PTSD is going to be really severe for the rest of their lives. We call that complex PTSD.
Complex.
And moral injury makes it all the worse.
The importance, the reason I mentioned family, so I guess I'm a family person, you know,
Yes.
is that we had veterans state that you are their family. You know, and that's when they love to come back. And I think Sergeant Robinson mentioned that too. He's every Thursday he comes to see you. The other veterans, they don't have any other. Sergeant Robinson got family out there, but others that don't have any other family. But
well, particularly with the younger vets, the therapy can be shorter. Sadly, many of the Vietnam and World War II vets didn't get treatment for 30, 40, 50, 60 years. And so then when they come in, it's worse. But we believe that some of our intensive short-term therapies, people can learn about this, deal with it, and they won't have to come back as much. If we can get them when they're young. But I do want to say this. Abraham Lincoln was quite smart, and our country can be very proud of our VA system. Whatever some of the concerns are, we take better care of our veterans in this country than any country in the world. And we're very proud of the new director of the VA and director of our local federal health, Dr. Holt and Captain Buckley. So we do have good leadership.
I'm glad you said that, because about a year or two there was investigations on veterans felt they weren't getting treatments correctly at not necessarily level, but at various centers, hospitals across the country. And I think the person who was head of the Veterans Hospital at the time was, he resigned or was dismissed. And because truly, those who, I mean, we're all entitled to have health, and I think health insurance, and that's another issue. But our veterans, we owe them, and they've paid their debt for all of us to be able to walk freely and take an I don't care attitude in this country. So when they come back and they're not treated fairly, that for me was a huge injustice. I'm glad to see Lovell is not part of that.
We're proud of the work that we're doing, and let's ask the sergeants how they feel about the care they're getting.
Go ahead, Tim.
I can't say enough about it. It's wonderful care. My wife would echo the same thing.
That's great.
There's a lot of different disciplines within the hospital that's available to us. And we typically use them on a week-to-week basis and get the best treatment that there is. A lot of the physicians that are there are outside physicians. One of the physicians that happened to work on a war injury for me, I had known for 30 years. And had utmost trust in him, and did a wonderful job.
Sergeant Robinson, what is your experience?
I found that going to the VA is quite an experience. They've tried to update a lot of things. The government got all the money, so you don't have to have secondhand stuff when you go to the VA. But sometimes it does take a long time to see a doctor. They're short on doctors. You know, so they'll say, well, it'll be 6 weeks, so you can't see a doctor for a month. I might not live that long. It will depend on what my ailments are.
So who do you see if you're not seeing a doctor when you go?
Well, sometimes they have interns in there, but I tell them right away. I've been most of the doctors I deal with there. I've been dealing with them for years.
Oh, so you want more of an experienced doctor?
Right. I don't want you coming in and telling me something.
From a mother whose son's getting ready to become a doctor, interns are doctors.
Yeah, but a lot of them don't.
So
just
I
like
understand.
a lot of them, like lawyers, they don't learn well in law school.
Okay. I'll go and tell Christopher that when I get home.
You know, I mean, I got a lot of respect for them, but if I've been coming to one doctor for 20 years for the same problem, you need to look in the computer. Don't ask me if you're an intern, because I'm not going to tell you anything.
Okay. Well, you know, so you might take another view in that you could be helping that intern to be a better doctor.
Yeah. Sometimes they get nervous. I'll ask them, how long have you been drawing blood? And the guy says, about a month. I said, step back. You know, because you shoot it too far, you know, you're going to...
Okay. But so it
overall,
would be nice if we could have more doctors.
Overall, it's good treatment there.
Okay.
It's good treatment.
Okay, and that's wonderful to hear, because President Obama, he promised that we were going to have better veteran hospitals, so I'm glad to see the level. And I do think level is state-of-the-art, and it is an outstanding example of what veterans, or any hospital, not just Veterans Hospital, how any hospital should be run, because my husband is a vet, and he's gone there on occasion, not for PTSD, although maybe he should. I think about it, maybe that's my problem, and I didn't know what to look for.
Could be.
I'm going to think about that tonight. But he always says that you're seen almost immediately. And that's why he prefers to go there than, you know, where we live out, there's a hospital, but he thinks veterans, he prefers level. He actually prefers level.
Well, we have more women veterans now. What about women veterans health care?
Yeah. Yes, and we even specifically to PTSD, we have a group for women veterans. Okay. I've had several opportunities to work with them individually, which is really exciting for me as a woman planning to enter the military, to have that kind of common bond. Many come in and they'll talk about groups being so effective is because people can understand them. So I think as women, we have more women veterans. It's great to have more women physicians, whether in the health medical field or the mental health field.
What is a commission officer? You mentioned that you're going to go into the Navy, into what branch?
Navy.
Okay,
plan,
into the
yes.
Navy. Thank you. I was going to say that. And you're going as a commission officer. What? Could you explain that?
Basically, when you have a degree and enter after, you're commissioning as an officer. So I would be commissioning to be an active duty officer as a psychologist. So when I'm done, and I will go through, if all goes to my plan, to my internship through the Navy, and then commission that way.
Would you have a chance to go to the Middle East, or you stay here in the hospital? Work
I could go anywhere.
They could
anywhere.
Ship you out.
Yes, right now we have psychologists in several branches all over. So I know at the other school where I go, we just had a teleconference with two officers in Afghanistan right now that are psychologists. Yes.
What is Operating Enduring Freedom and Operation Iraq Freedom?
Those are the recent campaigns in Iraq and Afghanistan. So when we talk about those veterans, very many coming back with these same issues, which it's so amazing having these Vietnam veterans kind of guiding the way for these younger guys to bring them in, because they know what it was like to not be welcomed back with the honor and dignity that they deserved. So often they were mistreated, and that they're doing a lot of work such as this to make sure that that never happens again. So they kind of grab those younger guys and pull them in. It's really
That's what
great.
I was asking. Maybe I didn't phrase it correctly, because that's what I was asking both of you. Do you work with the younger vets who come in now?
Well, personally, a lot of them don't want you to work with them. See, a lot of the military people have a lot of disbelief in our system of government. See, when you go to war, the government just throws you out there. Then when you come back, during that time, there was nothing. You know, you wouldn't even go to the VA. I never did.
But I mean, is there a group today for returning vets from Iraq or the Middle East that you guys would talk to as experienced veterans?
Why don't I comment on that, Charles?
Yeah.
Okay.
Yeah, we have specialized program for the younger vets, both outpatient and residential. So we do have a special program that is designed specifically for the young Afghan and Iraqi vets. And we will call them in a minute, and our social workers will help them get information about coming in. Once they're in treatment, oftentimes the young guys will learn so much from the senior men.
Okay.
So in the residential program, it's become actually, of the 200 vets who go through our residential program each year, it's becoming largely Afghan and Iraqi vets. The Vietnam vets are less, but so they're very much valued as models for the younger vets.
If I might interject, Dr. Beer has pushed me to attain a couple of therapy sessions with the younger veterans. I know the older vets, we have a lot to offer them.
Yes.
How we get into gain their confidence is probably the biggest challenges I see. It's a thing that we have amongst ourselves, amongst doctors, is that it takes time for us to begin to trust those individuals enough to participate and be an active member of whatever is trying to be accomplished.
I see. But why is research on moral injury so important to our society? Why do you think that's important?
Well, this is unspeakable. We know, and the staff at Level know, and the vets know, there are thousands and thousands of men and women who suffer with these problems with PTSD and moral injury and don't get help. And that's not befitting our country. Our country deserves to do better with vets, and science can do better. We've learned so much in the last 5 years or 10 years about treating PTSD. So the research, we are doing some very interesting research at Level with diagnosing and assessing PTSD and with effective treatments and involving family and treatments. So it's very important. I want to be sure to get back and say a little more about moral injury too.
Oh, feel free.
What I wanted, because this is so hard to talk about, I wanted to say that we ought to know that when you go to war, you're going to see and participate in things that you don't want to. It's not a clean business. War is a dirty business. And one study that interviewed or did testing with 3,761 paratroopers and Marines, they were asking them some questions about what they saw and what happened in war that bothered them. And the percentage that either killed an enemy, a combatant, in the paratroopers, it was 48%. This is from Iraq and Afghanistan. Of those interviewed, 48% had been in on the killing, and with Marines it was 65% had been in on killing. That were responsible for the death of a non-combatant, which would be a civilian or a bystander, 14% of paratroopers, 28% of Marines. That's a lot. Handled or uncovered human remains, 50% of paratroopers, 7% of Marines. Saw ill or injured women or children who they were unable to help. Imagine what that's like.
Dr. Bear, can the Army, the Navy, the Marines, can they prepare a soldier for what he's going to see when he goes in combat? I mean, is there any way you can really prepare them?
They're improving and they're addressing this, and it's more, the training is upgrading to include more psychological preparedness. But it's 69% of paratroopers and 83% of Marines saw children or women in helpless or tragic positions that had a buddy shot or killed who was nearby. 22% of paratroopers, 26% of Marines. Saved the life of a soldier or civilian, 21% or 19%. The point is that if you're in war, you're going to be part of and doing things and seeing things that you can never forget. And many people, we presume that it's the statistics show that it's around 20% will end up with significant PTSD. Some a little, some there may be a higher percentage. But once you have it, it continues to fester until it's addressed.
So what is your message to Lake County veterans and their family? What message would you want to explore with them this evening?
Please look to your family, your friends, your neighbors, and any combat vets you know, and invite them to use services at Level Federal Health, and specifically if there's problems with alcohol, sleep, family anger, don't hesitate. Give us a call.
Is it a 24-hour number? Can they get in contact? If someone's going through something at
Yes.
2 in the morning?
Yes, I believe you're going to
help?
flash that on your screen. I could tell you the number.
224?
Yes.
Okay.
Which number do you have?
I have 224-610-1463.
Correct.
Is that the correct number?
That's a fine
and
number.
And that is a 24-hour number, someone will be
Yes.
there to assist them?
Yes.
I have to congratulate you, Dr. Bear, for giving us the opportunity to let Lake County. And Lake County really is approximately 750,000 plus people, but I don't know, probably only about 100,000 people have Comcast viewing. But they can go on drbrooks.tv and they can watch this, Japan, Australia, and Florida, anywhere, because it's online. Again, that's drbrooks.tv. And I'm sure that Captain James A. Lovell Federal Health Care Center is very proud of you for making this opportunity available, because there's so many people in the community just unaware of the services that you provide. And you provide an outstanding. I would say this, I may just say, if I may, I'm a Korean vet. 13th of December, you don't forget, 13th of January, 54, I was sworn in. And the 5th of July of 54, I was in Korea. Now just think the traumatic experience that I had. Didn't quite know how to handle an M1 rifle. We don't have M1s now, probably, you know. An M1 sitting in the Korea. Now, we were replacements. The war ended June 27, 1953, and like I say, I went in the 5th of July of 54, right? But I was a replacement. They're ready to go. 30 miles from the DMZ. I was north of Seoul, you know. And fortunately, though, I was fortunate. I came back and not aware that maybe I had PSTD, you know, treatment and so forth, you know. But that's a traumatic experience. Now, I had an uncle in World War II. His best buddy in a foxhole got killed right beside of him, you know. And he returned to the South, packed his clothes, and he was in Ohio.
Yes.
You know, right away. So. Now that's another thing that he had to deal with, the situations in the South, but he couldn't take it anymore because he had to leave there. But so many of our soldiers are going through the same traumatic experiences. So hopefully that the government will, set up some type of programs and to try to facilitate and take care of these type of problems too, because soldiers are suffering this way too, you know. And so, but I want to thank you for, we have there's hundreds of, probably thousands of people that and that's the reason I mentioned about the time involved. A person could go through 6 weeks or 30 days or whatever. Who determines whether is it renewable or how does that work?
Well, it's individualized assessment.
Okay.
And as many vets will come for a few sessions and that'll be adequate. Or they may come for 10 sessions, or they may go 20 sessions with our short-term therapy. But if they've got it bad, then they're going to have to be involved in some longer-term therapy.
So this is good for the
Could
community.
you address the military sexual trauma?
You know, we hope that you're going to invite us for some of our colleagues for another show on that topic. But sadly, it's more common than anybody can believe, and it deserves. And we have a sexual assault program at Lovell, so for women and for men. So Cassie and some of the students work with a male sexual assault group, and then we have a specialized sexual assault clinic for men and women. And so we invite also any veterans who have that issue, please come and work with us.
Okay, because she had mentioned that there's women, there are more women in the military now actively. I think that in the 80s, I don't know if women had combat experience like today, they're actually going through combat.
About 17% of those in Afghan and Iraq are women,
actual
females.
Combat.
Well,
So,
they're in the field. They're 17% in the field.
Okay, and so I was just wondering if the sexual trauma was related to experiences that they saw abuse or they are experiencing as women, and I'm speaking from the woman's perspective.
Themselves, frequently. And male and women. It's really a kind of misnomer that only women are sexually assaulted in the military. Men assault men, women assault men, men assault women. It really, there's too much of it happening all the way around. So definitely individual treatment is provided for that, as well as groups to be able to come and have that understanding of people who have gone through that same thing, that they're not alone. And same with a PTSD group. It's really healing to be able to see that other people are going through something.
Well, what is Operation New Dawn? Can you address that? Is it similar?
You know, I'm not as informed on that as I should be, so I won't comment.
Oh, okay, because it was right next to the sexual trauma, and I didn't know if they were related.
Oh, they're not related.
Okay.
It's similar to these Iraq and Afghanistan campaigns. It's in this last kind of 15 years. Yes. I just don't know the exact parameters.
Okay.
Well, what's new now for moral injury and as it relates to post-traumatic stress disorder? What can we leave here, and so that the public will know how it assimilates the connection there?
The fact that your show, and I commend both of you, the fact that your show is having this special topic.
Okay.
You know, this is not a common point of discussion. This is new, and for these sergeants to step up and talk openly and invite people in, this is what's new. That we are inviting people in. It's like we're taking off the curtain. We're opening the curtain and saying it's okay. We have treatment to help people that have things they're so ashamed of they don't think they could ever talk about.
Well, the door is open at any time, and also the Sergeant Robinson has been on the radio program too. So when I can catch him when he's not in a warmer climate, because as he stated, Tuesday he'll be going to a warmer climate.
Yeah, well.
So we appreciate your time.
Thank you very much.
Your willingness to be on the program to let Lake County and Cook County and also Kenosha County, you know, to know about how important they probably never realized. Some people never realized they have it, right? And now they can, families now can maybe take a close look and recommend that, you know, that the treatment is available. And Tara, I want to thank you very much for taking time for your very busy schedule too. You know,
well, I think this topic is very important, and I think it affects more of our citizens than we're aware of, and our loved ones. Because sometimes you don't know, like, you know, that's why I asked you, who determines, or who is it the first person to cite it? Is it the individual going through it, or is it a family member or a loved one or someone you work with and thinking, you know, because women go through, certain women can have depressions each month as well, you know, and you don't know, is it psychological, is it hormonal, you know, how do you really know? And that's where I guess where level comes in to make that determination. So I am honored that you allowed me to sit in on this one.
Okay, and we have two sergeants here. They both, one U.S. Army and you're a U.S. Marine. So they do get along, don't they?
Yes.
Sure they do.
And I have the same, you're both, red blood goes through your veins, and you know, you react the same way towards combat, and we want to thank you very much for serving our country.
Well, thank you.
And I'm sure that the military people coming back into civilian life, to making this readjustment, is going to get much more help, and we thank Captain James A. Lovell Federal Health Care Center for providing this. Ladies and gentlemen, we've been talking to Dr. John P. Patrick Bear. He's a clinical psychologist at the James A. Lovell Federal Health Care Center. Sergeant Charles Robertson, Vietnam War combat veteran, U.S. Army. Miss Cassandra
Shimsa.
Shimsa, thank you, doctoral student at Adler Institute, specialty in military psychology, and anchor person, Sergeant James Reinhardt, the United States Marine Corps and Vietnam combat veteran. And of course, this program would not have been possible without the co-host, Mrs. Tara Thomas, who's an educator in Lake County. And Tara, you working on your master's now?
I'm finishing that and starting the doctoral behind my colleague here.
Okay.
my soon-to-be doctor.
and you have two sons. One son is working on his doctor's too?
Medical school.
Medical school,
Right.
okay.
He's the one that Sergeant Robertson is not going to trust. Because he wants to be, I'm going to go home and tell him, there are people who don't trust you.
Really?
So, but that's great to know. That's why I'm asking Sergeant Robertson, be a little kind,
Oh, well.
And the other one's a lawyer.
One more time, the phone number that the community may
Yes.
call for more information.
I think it's fabulous. Do you want to give that, Dr. Bear? I can give it to you. It's 224-610-1463. And let me just say that slower. 224-610-1463. And the great part is a 24-hour number.
Thank you very much. I may say that my first professional employment was at Downey Veterans Hospital at that time, 1957 to 1968. I was an educational therapist, and now it's the Captain James A. Lovell Federal Health Care Center. So I still have connections. As a matter of fact, I was out talking with friends that haven't retired yet just yesterday. So I still have that connection. Ladies and gentlemen, this has been Community Forum. My name is Dr. Waddell Brooks Sr., your host.